it's Kristen here at UT Southwestern Medical Center. Thank you for joining us today for our Heart Month Facebook Live chat on protecting your heart. We are super glad to be joined today by Susan Rotter, who's a clinical dietitian here at UT Southwestern, as well as Dr. Amit Khera, who leads our preventive cardiology program. It should be a really great chat, as usual. Don't forget to like and share the conversation so this will spread to friends and loved ones. And you want to ask your questions in the comments section of your Facebook feed. So just to get started, I think we had a really good question right off the bat from Jenny King. Jenny asked, what is the impact of good versus bad cholesterol levels on heart disease? You want to take that,
question.
Dr. Khera?
Well, first, thank you for having this. I want to remind you it is Heart Month, so this is a wonderful time to do this. Go Red for Women Day was February 2nd, and one cause of death in women, so this is excellent. Great way to start. So good cholesterol versus bad cholesterol. Good cholesterol is your HDL. The higher the better. In women above 50 and men above 40 is considered good. The bad cholesterol is LDL. I'm going to start there. The most important thing is actually your LDL cholesterol, your bad cholesterol. Not only is it a good barometer of your heart health, an important risk factor, but it's something that you can actually change with diet or medicine, which we'll probably talk about. So it's one thing, not only does it tell you about your risk, but something you can actually measure, track, follow, and treat. HDL is interesting. It's been around forever. I was just at a lecture yesterday. We do a lot of research on HDL here. And it's definitely a marker, meaning if you have a low good cholesterol, you're at higher risk. If you have a high good cholesterol, you're at lower risk. But it doesn't seem like it's something we can modify that much.
Okay.
And we've learned that in the last several years. Several studies have looked at this using different drugs and different things and trying to change it with medicines or otherwise. It doesn't seem to change your risk that much. So we pay attention to it, but we pay a lot more attention to your LDL, your bad cholesterol.
Awesome, great news. So, don't forget, as Dr. Khera said, it is Heart Month, and that's one of the reasons we're having this chat. We did want to thank the American Heart Association for helping us promote all the things this month. Now, moving on. So, Susan, I know you work with a lot of heart patients here at UT Southwestern, focus on their diet. Are there certain foods that people should be including in their diet just as a staple to help protect their hearts?
Absolutely. When it comes to heart health, they should definitely be including lean protein, which would be from turkey, chicken, and of course fish. The deep water fish contain those omega-3 fatty acids, and then soluble fiber. That's something that people never kind of emphasize and talk enough about, but those soluble fibers help bind bile acids in the gut, and that doesn't really lower LDL a whole lot, but it does help a little bit.
Okay.
So the soluble fiber would be found in oats, like oatmeal and Cheerios, sweet potatoes, Brussels sprouts, and other fruits.
Okay, so it sounds like there's something for everybody. You get the sweet potatoes, you get the Brussels sprouts. If you don't like Brussels sprouts, you can have oatmeal.
Exactly.
A little bit of everything. Okay, so great answer there. We are starting to get some questions. We should have a lot this half hour. The one is, so that we talked about just a little bit earlier, I've heard coconut oil is good for your heart. Is that true?
We do not suggest coconut oil.
Okay.
It does have that tendency to lower triglycerides a bit, but it does elevate LDL cholesterol. So there's a recent research study looking at 12 observational and 8 clinical trials, and it strongly suggests that we don't use coconut oil as a replacement for our mono and polyunsaturated fats.
Okay.
Let me comment on that too. First, a little aside, in our preventive cardiology program, we have a nutritionist, sees every one of our patients, and that's why we're here today, because diet is such an integral component, and Susan, we're very fortunate to have her as part of our program. So I'm glad we're talking about this. Coconut oil is we joke in clinic, there's different trends. And for the last couple of years, it's been coconut oil, not just because we see it in all of our patients, but if I go to the grocery store, they have aisles devoted to coconut oil.
They really do.
Our take home on this from a heart perspective, great for the outside of your body, maybe good for your skin or otherwise, but not so good for the inside of your body. Let me comment on that. What's been shown is that coconut oil it raises your good cholesterol, our first question, but it definitely raises your bad cholesterol. It definitely raises your bad cholesterol, your LDL. Now, it may not, in some trials are even done here, may not as much as butter or some others, but it still does raise your bad cholesterol. So if you have alternative choices, everything in moderation, but in my personal opinion, it is not, if being better than bad doesn't make you healthy. Does that make sense? People use the word healthy. I think that part is not appropriate.
Okay, so what would be a better oil if somebody's using coconut oil in their cooking, or I heard you say they put it in coffee? What's a better option for people?
So we want to look for basically any liquid oil.
Okay.
So an extra virgin olive oil. It could be even a polyunsaturated fat like a corn oil, canola oil, safflower oil, etc.
Okay.
So essentially a non-solid oil.
Okay.
For your coffee, probably not so good.
Yeah.
Yeah, great question there. Thanks for bringing it up. So we've got one here from Karen, and this is an interesting question. I've heard this before. She says, my HDL and LDL are normal, and she had the quote marks with normal. She says, I like eggs. I'd like to eat eggs for every meal, as well as other fruits and vegetables. How many eggs a day is too much?
We were just saying we're going to get an egg question.
Yeah, so USDA Nutrient Evidence Library indicates you may have 1 egg per day. Mm-hmm. They would prefer that you not exceed 7. Mm-hmm. It's not quite as good for our diabetic patients who seem to be more sensitive to the dietary cholesterol in the egg yolk. Okay. So for them, they might want to even cut that back down a little bit. But the rule of thumb is 1 a day.
Okay, 1 a day. There you go. Great question. Thanks for asking. So here's one, I think this would be for you, Dr. Khera. It's from Susanna. This is a great one. She says, is there such a thing as too much exercise having a negative effect on the heart?
Man, that is such a good question. This is a really hot area, I'll tell you. I run, and there have been a few studies lately suggesting that there could be too much of a good thing, that you can actually run too much. I'll spend 1 second on that. Been a few studies, so certainly people who are regular exercisers are much better cardiovascular health and lower risk. But can it be too much? And there have been a few studies now that people that are, let's say, ultra marathoners or something more excessive than that there may be more buildup in their heart arteries. I'll tell you why it's controversial. One more thing, a couple of studies just came out recently, and in the arteries of people who were these ultra runners versus not as much,
right.
There was more buildup, but it was also more calcified, meaning it's more stable and less likely to cause a heart attack. So it's a little complicated, and one last thing that makes us feel complicated is even studying it as a researcher. A lot of people who decide to run and do things, it's because they have a strong family history of heart disease. Jim Fixx was an athlete that died in the 70s, famous marathon runner. It turns out he had a really strong family history, and that's why he was running. Right. So the short answer, my personal opinion, is everyone should exercise. There's a little bit of evolving data. If you're an ultra marathon runner, there may be some heart issues. They say always check with your doctor to check on your heart appropriately if you're doing those really strong endurance exercises.
Okay, really great question, Susanna. So we've got a follow-up to that. This one's from Lori. She asked, how much should I raise my heart rate when exercising?
Yeah, great question. And part of this gets into training, so what's good training, and the other part is safety, right? So we don't want people to exceed. The first thing I'll say, and I say this to everyone, if you're not doing a lot of regular exercise, just start slow. You're not trying to run a marathon the next day. That's when we get into trouble. That's when you hear people dying. Suddenly it's because they're weekend warriors. You never want to do that. So build your base of exercise. First work on getting, the official recommendation is 150 minutes a week of regular, moderate intensity. Like brisk walking, that's 30 minutes a day, 5 days a week. If it's vigorous, the minimum is 75 minutes, like jogging. So get your base. In terms of the heart rate, what I usually recommend, and it's a little open-ended, we usually start at what we call max predicted heart rate. I have to be careful, I'm not giving you medical advice, but this is sometimes broad ranges. So whatever your maximal predicted is usually 220 minus your age. So if you're 40, it'd be 180. Okay. I usually start at 50 to 70% of that, and then once people are a little bit more habituated to that, then 70 to 85%. Gotcha. So that's a reasonable target heart rate range. But again, this is individualized. If you have heart problems or have long-standing diabetes, make sure you check into that before you decide to do vigorous programs.
Really good advice. Great question there. So here's one from Veronica, and this is kind of related. She asked, how much water is too much, and is coconut water good for you?
Well, unlike coconut oil or coconut milk, coconut water is kind of like nature's natural Gatorade. It has a little bit of potassium in it, very few calories, and mostly just water. So the coconut water, as long as it's not flavored, like with vanilla or chocolate or something, it's fine.
Gotcha.
And then in terms of water, we're still looking at about 2 to 3 liters per day, or the classic 8-ounce glasses, which would be roughly 2 liters. Not exceeding about 3 liters per day.
Okay. So not exceeding. What happens if you exceed? Is that
if you're over drinking your water, you can become hyponatremic, and you've seen that reported in some of the marathon runners.
Sodium gets low in your blood,
and then they can start getting dizzy, and things can go downhill from there.
Geez. All right. So, different question also for you: is it true that some foods are addictive?
Ooh, good question. I guess it would depend on how
Other than
exactly,
chocolate?
yeah, how exactly you define addictive. I would say most of the patients say that there are definitely foods that are addictive. There's some research on snacking, and if you do snack on those things that you really do like a lot, that you tend to increase the amount or the frequency with which you're eating.
Okay.
So for many years, dietitians have been taught to encourage people to have those in small amounts and less frequently.
Okay.
And there's been some recent research that indicates that even exposure to those foods that sort of trigger people or that they know they're very sensitive to accelerates eating more of them.
Okay.
So I don't know if I would define that as addiction, but it depends a little bit on the patient
Right.
and what they're eating.
Right, and we actually have a follow-up from Heather. And Heather asked, speaking of addicted foods, or addictive, willpower over my sweet tooth is a daily battle that I usually lose. Any advice for someone who refuses to give up her afternoon chocolate fix, but wants to cut down a bit more on carbs and sweets? There's some good options there.
Well, first you would go right to fruit, and that use the sweetness of that fruit to try to satisfy that fruit tooth. As a matter of fact, many parents will do that with their kids, where they'll allow them to have a dessert after they've had their piece of fruit.
Okay.
And then you do need to keep that dessert small. The dark chocolate, greater than 70% cocoa, or even if it's something else like a frozen yogurt or something, still keeping it moderately small, half a cup, things like that.
Yeah, let me add to that. Part of this becomes, is some tricks and things. Number one, if you do have a sweet tooth, do not have a bag.
Right.
Take a piece and count it out or put it out. So you cannot just leave yourself exposed to as much as you can have.
Reaching in.
And also, I think, as Susan mentioned, sometimes you just need to have a patient think about it, or a person think about it, about what are alternatives, right? So there's the Snickers bar, there's the small piece of dark chocolate with 70% cocoa,
Right.
There's the fruit. So there's always alternatives. We have people that love ice cream, but once we teach them a little bit about, be it sorbet or frozen yogurt things, they're just as content.
Yeah.
But it's just making that change.
And it's a little bit similar to somebody drinking whole milk and then going down to a lower percent fat milk.
Okay.
If people learn to eat that sweet in a less sweet form or in a smaller form, they do actually become acclimated to that.
Gotcha. Good to know. So great question. We're going to keep them. We've got a lot of questions here, so keep them coming. Here's one from Kristen, and this is what I think both of you could address. She says, what strategies do you recommend to your patients for motivating themselves to eat better, exercise, stop smoking, the variety of things that are good for your heart?
And step back,
Okay.
they can identify themselves certain patterns that they're engaged in that aren't as healthy and things like that. So for sure, becoming just generally more mindful of what they're eating and if they're exercising and things like that. That's the basic place to start.
The biggest
Yeah,
thing.
this is the holy grail here to figure out behavior change, right? And there's no one size fits all, because everyone lives in their own world, in their own context, and their own stressors.
Right.
In my opinion, a couple of things in addition to what Susan said. We're talking about motivational counseling here. A little introspection into what are some of the challenges and why do they perceive them. Understanding what's their social structure and where do they have areas of support and where the areas. So, if this is a person that's busy with work or has family stressors, and then so essentially what I say is I call it social engineering. You can't wish for these things to change. You actually have to make a plan. So we try to get them beginning to think about what that plan could be. For example, exercise.
Gotcha.
We sit down and say, what time in the day is most available to you? Is it the morning? Is it the afternoon? Is it night? Is it weekdays? What days would that be? What do you enjoy doing? And then sort of constructing a plan that they would then follow out. So I think it's really taking the time to think through the logistics of how you do something, and not just the goal of, I'll try to do 3 days a week, because those days never happen.
So do you have them go ahead and actually write it out?
Yeah, we write it out. We sit down with a plan, and we actually type it in our instructions to them.
Yeah.
What days of the week and how we do it, and sort of begin. And she does also for nutrition, sort of the 3 things they're going to do and how they do it. So I think not just the idea of doing something, but what are the specific logistics, right?
Gotcha.
Because we really have to think through them, and it's different for everybody.
Gotcha.
And it helps to, when they, in the process of identifying what they can change, they kind of say, well, I could, modify my diet in this way, but I couldn't in that way. And then they are the decision makers, and they're empowered to allow you to help direct them into what they can change and incorporate and what they can't. So then they just feel better about it overall.
Sounds like they're really part of the process and that they have to be. Okay. So really, really great question, Kristen. Thanks for submitting that. We've got one here from Ashley, and these are so just perfect questions. And Ashley says, what is the number one thing you recommend for young adults entering their 40s to maintain their heart health?
Great question. Maybe I'll start there. I love that a young adult is thinking about this, right? Because historically what happened, 20, 30, 40 years ago is we were just waiting until, bad things happened and then fixed it on the back end.
Yeah.
And what we've really learned is the earlier you start in life, and this is a closing in on 40, I'd say, what should a 20-year-old be asking, because the sooner we start making changes, the better. I'll just say three things very briefly. One is know your numbers. Maybe we'll get to that a little bit later. But because sometimes there's severe risk factors, genetic things that you need to address regardless of lifestyle things we're about to talk about. So definitely know your numbers, blood pressure, cholesterol, your weight, etc. But the main thing is it's pretty simple. Eat better, move more, and trying to make that a habit. What I tell my patients, when we start talking about it, we're not putting you on a diet, nor are we trying to create a 6-week plan. We're trying to change your life so this is your default of what you do, and find ways to maintain happiness while you're doing that, and find some joy out of that. But so really trying to get people to exercise regularly, whatever that means. We can talk more about that, and then eating well and eating thoughtfully about how they eat. And again, one last thing I'll say for someone in the 40s, close to probably having kids age, not everybody does, but those that do, it's not just for that person. You're actually treating their whole family because their kids eat better too.
Right. Yeah. All right, so we're gonna follow. We have a question now from Sarah. And this, I think this is accurate. Is supplemental CoQ10, yes, beneficial for heart health? I'm not familiar with that.
From the research that I've looked at, it isn't going to harm, but it's not necessarily going to bring back those levels up.
Okay.
Classically, people who are on a statin are taking that supplement because those levels drop a little bit on a statin. But the research that I'm familiar with shows that it doesn't really bring them up.
Okay.
But it's not harmful.
Okay. Thanks for bringing that up. I learned something new today. All right, here's a different one. This one is from Christina, and it's about sodium. She said, how much sodium should you have daily for good heart health?
It depends a little bit on how many calories you need. So rough ballpark, a good rule of thumb is 1 milligram of sodium per calorie.
Okay.
So if you need 2,000 calories a day and you have elevated blood pressure, it would be great if your sodium could be 2,000 milligrams or less per day.
Okay.
If you're a woman who only needs 1,500 calories, then that would drop to about 1,500 milligrams per day.
Okay.
You do need some sodium, so
Yeah.
people really shouldn't drop below about 1,500 milligrams.
Okay.
Except that it's so hard in our current diet to really get too low in sodium because it's everywhere.
It is everywhere.
So I think for most people we end up having to restrict. And can I ask a question? Because this comes up all the time.
Yeah.
Susan, can you clarify? Because it always comes up about sea salt versus kosher salt versus table salt. Is there a difference in the sodium?
So the table salt, the sea salt is about 5-10 milligrams lower than the table salt.
Okay.
And then the kosher salt is about 100 milligrams lower than regular table salt.
Okay.
So salt is salt. They're all full of sodium. So it's better if you can use herbs and spices and lemon and flavoring, because as
So it's not like when you do kosher salt, everything's fine.
Right,
It
exactly.
still has a fair amount of salt.
It still has
Sodium.
380 milligrams per quarter teaspoon. So the thing is that and like Dr. Khera mentioned, you're going to get most of your sodium in processed foods, and like even a processed food would be considered a glass of milk has a little bit of sodium, so you just don't need to be adding a lot.
Gotcha. Okay. So we've got a question more about treatments, and I see questions here from Moy and Ashley and Christina. We're going to get to all those. We're going to take this one first because she's been waiting for a minute. What treatments are used to combat heart disease?
Sure. I'll try to answer that succinctly.
There are a
people
lot.
who have heart disease, and if people trying to prevent it. I'm just going to assume that question is maybe if you have heart disease, I guess.
I think so, yes.
So if you have heart disease already, you're in a completely different camp because now your risk has just gotten higher. And so then we have to be more aggressive and implement. So it's not medicines or lifestyle, but both. I couldn't say it enough times because lifestyle alone is so important, but it will not be enough if you already have heart disease. Medicines alone are so important, but they're not enough either. So really it comes down to a lot of preventive medicines like statin drugs, a baby aspirin a day, things like that. There are other medicines we use. And occasionally we use treatments like stents and bypass, but The take-home point that I'd say is there's medicines and treatments, and then there's lifestyle, and it is actually both, and both are really important.
Okay, good to know. So we've got a question here from Moy Lim. I apologize if I misspelled or mispronounced your name. She asks, do stress and a feeling of loneliness, can they affect your heart health? She says she has some stress and that results in a rapid heart rate. Is that pretty normal for stress to impact your heart?
Go ahead.
Oh, no,
okay.
Go ahead. Yeah.
So I'll just say the answer is yes. Yes, the challenge is, unlike other things for studying it, just a little harder to study. Stress, it's hard to quantify. It's not like your blood test of your cholesterol, so it is harder to study, but I think if you look at all the studies, it's clear that stress plays a role. I think it plays a role in two ways. One is it likely increases your risk, but secondly, when people are stressed, it's harder for them to do healthy behaviors, so it's harder for them to take care of themselves. So it's kind of like a double whammy, but I think the short answer is yes, so definitely something we should take care of, and think about that as we take care of ourselves.
Okay, good answer. So here's one here, a follow-up from Ashley. She asked a couple questions earlier. Now she's wondering, can you undo damage to your heart if you catch it early? Is that something that you address in your program?
Well, sort of. The short answer is it's mixed. If you've had a heart attack with damage to your heart muscle, the heart really doesn't regenerate, although there's a lot of science going on with that. So if you've actually damaged your heart muscle, the best goal is to keep it from getting worse. When it comes to blockages and buildup in your arteries, if there is some, the evidence suggests that if you can really get extreme, really lower your cholesterol a lot and bring it down very low, we can definitely stop the process, so keep it from getting worse. And maybe it goes backwards by a little bit. In the biggest study, 1% per year. So technically backwards, but more importantly, it stabilizes things. So we can definitely keep things from getting worse. Remember, you start atherosclerosis in your teens, the buildup in your arteries. So by the time you're 60, it's been going on for 40 years. It wouldn't be reasonable to think you can make it all turn around within a week or two, which a lot of people want, but it's just not possible.
Okay, that's right. Here's kind of a softball. Let's see, is vitamin E good for your heart? That's from Christina.
Originally and historically they thought that was helpful, and so it was included in many of the studies that looked at dietary supplements and heart health, but they found that it really didn't have any effect.
Okay.
And they've even concluded that with several large studies with regards to multivitamins not really having a significant impact on preventing cardiac risk or heart disease at all.
Interesting.
So if you need to take a multivitamin because you're not getting, all your nutrients, or you've had bariatric surgery, that's a totally different topic.
Okay.
But for prevention, it's the data's not there.
Okay. Well, we had another question earlier on that we missed. This one was from Andy. She asked, do you recommend a vegetarian or vegan diet?
I'd have to say that I recommend a Mediterranean diet or the DASH diet.
Okay.
If you want to eliminate the animal protein, not a problem. That's your choice. We just have to make sure you get enough iron and B12. We know that more of those plant-based diets are more heart healthy, essentially because they're lower in saturated fat.
Gotcha.
But the DASH diet, which is dietary approaches to stopping hypertension, helps lower blood pressure.
Okay.
And we know that the Mediterranean diet it reduces risk of cardiovascular outcomes such as heart attacks and strokes and things.
I just want to add to that. I think that's such an important question, and Susan said exactly right. The only part that I want to add is all of these heart-healthy diets are more alike than they are. We have more in common than we have apart. They're all saying more fruits and vegetables, whole grains, less saturated fat, red meats, and things like that, all of them. The one problem with vegan diet and vegetarian diet is people use that as that must be healthy. Remember, and I always say it's a vegan can have soda and Oreos.
Right.
You can have that in a vegan diet. So that's not it. It's not the name of the diet, it's what you're including in it.
Very, very good point, though. I've known vegans that only eat French fries, and
right.
That just doesn't
That
really
can't
be healthy. So we have about 5 minutes left for our chat. We're going to try to get to all these questions. If you haven't asked your question, please do so now, because we're gonna have to stop. They've got to get back to their jobs. We're happy to have them.
We're getting lunch. No.
Yes. So we have a good question here from Christina, and this is interesting. Can the heart rebuild its strength after quitting smoking, and how long before it gets back to normal?
Yeah. Good question. Listen, quitting smoking is the most important thing you can do in terms of, or said another way, smoking is the #1 preventable cause of heart disease. Although, now we're about 20% or a little less in the United States, so numbers have come down. We're very happy for that. And I just want to say, if one is smoking, I appreciate it's very hard to quit. So we get it, and sometimes it takes a few times, but it's the most important thing you can do. The answer is yes. There's evidence that after a few years, your risk gets closer to normal. So it can, the short answer is your risk does come down significantly after you quit smoking. So there is a lot of good reason to do that. It's never too late. One last thing is when people do quit smoking, most people gain weight. And I always tell my patients, if you gain weight, who cares?
Yeah.
Quit smoking, we'll deal with it later. So definitely so important to quit. It can get you closer back to where you were before.
Okay. So here's another question, and this makes perfect sense. You know, Ashley, she says, you know, there are so many conflicting opinions out there about what is good for you. You know, it's coming from the media, it comes from the web, it comes from all over the place. You know, and she specifically says, you know, what scares you two that's out there that just is completely false?
That's a good question.
You know, I completely get that question, because even for us, we'll, you know, spend a lot of time researching in science, and then the next day we find out we were wrong. Right. So my fear is guiding people based on the current science and then some new discovery. But I think it all comes down to common sense. If you just stop with common sense, you know, what's reasonably healthy, and if you follow that, you know, prudent diet, fruits and vegetables, just, I can't see that ever being wrong, you know?
And I think the thing that would frighten me the most is when people just sort of take an extreme approach. I mean, and that's what you're alluding
the fads,
to. That's the fad diet where you're eliminating a food group, or you're, you know, adding extra this or that, and it's just not conducive to anything you can sustain or to fighting chronic disease.
Gotcha. A really good question. Thanks for bringing that up. So I'm gonna combine a couple here. We've got, you know, one from Moy, which is pretty specific. She's wondering what vitamins are good for a 52-year-old woman with high blood pressure, and combine that with, we've got a couple individuals here, like, what are the best tips for sticking to a heart-healthy diet throughout life? I mean, those are both kind of all over the place.
So with regards to her vitamins, she wants to make sure she's basically, as per the DASH diet, getting adequate potassium, calcium, and magnesium. And you can't get potassium in a multivitamin. It's very low in there on purpose because it might interfere with medications. So she needs to go back to the food and get potassium in fruits, vegetables, lean meats, and so forth. The calcium will come from low-fat dairy, and we do know from the MESA study it's better if it comes from food rather than from dietary supplements. And calcium is critical for high blood pressure. And then magnesium, which is found in nuts and beans and legumes and chicken.
I'm going to also add to what the second part of the question was, what's the tip for maintaining a heart-healthy diet? First, I would use the word diet, you know, because this is an eating pattern that you're going to have. And I think starting young, you know, teach your children when they're young in your home. Don't, you know, have healthy foods, lots of fruits and vegetables, healthy snacks, because that's what's at hand. Think of smaller portions we eat on salad plates at our house, because it's so easy to eat on large plates. So I think really starting with fruits and vegetables is your staple. Having healthy items in the house. Don't think of it as a diet, think of it as a healthy lifestyle. How do you adhere to that? And then it becomes autopilot. You don't have to think about it.
Yeah, and certainly not being afraid to cook.
Cook.
If you can, I mean, you can cook some amazing vegetables if you experiment and just work with herbs and oils and, you know, actually get in the kitchen.
Absolutely. I like to cook somewhere. Not very good at it though. So we have one other question. This one comes in from Christina. She asks, do you recommend taking an aspirin a day for heart prevention?
Great question. The answer is in some people. Most people know. If you look at the evidence in men who are higher risk, so generally if a man's over 50 with some heart disease risk factors, then an aspirin may reduce enough heart attacks. The reason we don't give it to everybody is aspirin causes bleeding ulcers. So if you are really low risk for a heart attack, you're just going to cause more ulcers than heart attacks you prevent. So a man over 50 with some other risk factors may be reasonable. Talk to your doctor. In women, it's more controversial because there's only one big study in women prevent heart attacks and strokes. And the short answer is if a woman had a strong family history of stroke or was over 65 with some risk factors, may be considered. But again, it's always weighing. It does cause bleeding ulcers. So the risk has to be high enough. It's not for most people.
Gotcha. Okay. We got to close it out, guys. It's been a great chat, but we have this one last question. This is from Ashley, and this is actually really important. You know, for somebody with a family history of heart disease, what testing do you recommend that they undergo?
Sure. You know, in family histories, I'm so glad that person knows their family history, because there are a lot of misconceptions. Still, people tell me if I'm a woman, it doesn't count, and that's completely untrue. It doesn't matter if it's your dad or your mom. If you're the child of that person, it doesn't matter male or female, it still counts. You know, start with the basics. Know your cholesterol, your blood pressure, diabetes. A lot of what you're inheriting is high cholesterol, predisposition to diabetes, overweight, hypertension. So know your usual risk factors. Know them earlier in life. Don't wait when you have a family history. In some people, when those are quote, quote, normal, and if their family history is a little more scary, there's multiple relatives, they're younger, then there's some advanced tests. This is where you can see a cardiologist or a preventive cardiologist, and there are some advanced blood tests and pictures of the heart that occasionally will do to help better give you a crystal ball about your risks and define a better plan for you individually.
Okay. All right. Well, given that it's Heart Month, I want to give both of you one last opportunity to, do you have a message you'd like to share with our viewers about Heart Month and the importance of what you do?
Well, this is the time to get out, get back in the kitchen, experiment with cooking foods, incorporate some of the ancient grains and fruits and vegetables, and just have fun with food instead of sort of thinking of the negative message of I can't have this and I can't have that.
Okay, awesome.
I think it's a great way. I'll just say it is Heart Month, so great way to think about it, but I hope we have Heart Year and keep going throughout the year. And Susan gave us some great tips about making food fun again.
Awesome. Well, I want to thank Susan Rotter and Amit Khera for joining us for this half hour. Thank you for all of the great questions. It was really fantastic. This chat will be available on our Facebook as well as our YouTube channel later this afternoon. So share it, ask more questions, comments. You know, we really appreciate your time and I hope you have a wonderful day. Thank you.
Thank you.
Thank you. Thank you.